This section of the lecture is on cancer treatments. How do we treat cancer or even cure it? So, in the United States, around 40% of people will develop cancer in their lifetime. Now, this is excluding the more benign forms of skin cancer, and it's excluding prostate cancer in men over the age of 70. Most men who get over 70 will develop prostate cancer but die of something else. Prostate cancer generally kills when it starts in younger men. Okay, that's probably phrased wrong. Younger men are more at risk of dying from prostate cancer if they get it. So, 40% of people develop cancer. Only about 22% of people die from cancer, which means around half of all people who get cancer are cured of that cancer. How do we cure cancer? I know you hear, we don't have a cure for cancer. We do. We have cures for certain types of cancers. Not all, but some of them. The first thing you want to do is catch it early. So, which ones can be caught early? We can do regular screenings for prostate cancer. There we go. Top of the list for survival rates. Breast cancer screenings, right up there for survival rates. Cervical cancer. The cervix is part of the female reproductive tract. That's what Pap smears are detecting. Rectal and colon cancers, so for colon screenings. A lot of types of skin cancers can be detected early and are very survivable. The American Cancer Society and the National Cancer Institute have recommendations for what you should get routinely screened for based on your age. Other types of cancer are not as survivable. A lot of these are because it's hard to detect them early. Liver cancer, pancreatic cancer, lung cancer. A lot of times with these, by the time you have symptoms, the cancer has already spread. It's metastasized. And that makes it much, much harder to treat. Once again, we're talking about solid tumors. Bone cancers can be treated with some of these methods and a few other types of methods, including bone marrow transplants. Bone marrow transplants are very difficult for the recipient, but very, very relatively easy for the donor. You can sign up to be on the bone marrow transplant registry. They take some information. When I signed up, they took a blood sample. You may never ever hear from them. But if you do, the procedure is an outpatient. Depending on the procedure, they may just need to take blood from you, or they may need to do an outpatient surgery, which, you'll do it on a Friday and by Monday you'll be back at work and you saved somebody's life. Each cancer is unique. Oncologist, onco refers to cancer, ology is the study of, oncologists are doctors who study and treat cancer. And they usually specialize in a specific type of cancer. So if you have liver cancer, you'll go to a liver oncologist. Breast cancer, breast oncologist, and so on and so forth. Each type and stage of cancer will have a different treatment, and the genetics of the cancer, the specific genetic changes, will affect the treatment. This lecture, I'm just giving you the big overview of the types of treatments. Each cancer patient may get some or all of these treatment types. All cancers should be treated by an oncologist. So there are alternative medicines out there, and they can help symptoms, but they do not cure cancer. And it's very important that your oncologists know what alternative medicines you might be taking. These can include herbal supplements, teas, vitamins, because sometimes those will interfere with treatments. I am also not a doctor, not a medical doctor. The information here is not a substitute for seeing a medical professional. I'm happy to help interpret science and medicine, but I cannot give medical advice. Other than this, here's your medical advice. If you have cancer, see an oncologist. If you think you have cancer, see your regular doctor and find out. Okay, now that all of that is out of the way, let's start by saying surgery. For some cancers, usually stage 1 and a lot of skin cancers, surgery is the only thing that's needed. You remove the cancer before it metastasizes and just monitor. Higher stage cancers, you often will also have surgery. You can sometimes remove an area of cancer cells and healthy tissue and get all or most of the cancer out. It can also reduce symptoms in higher stage cancers or if the tumor is producing hormones, for example. So that's the first step. Chemotherapy is the second step, and it's what most of us think about when we think about cancer. Chemotherapy is treating the patient with chemicals that kill fast dividing cells, trying to kill the cancer without killing the patient. Side effects are common. Some treatments have more side effects than others. And these side effects can last for over a year after treatment ends. So it's not once you're done, you're magically back to normal. It takes a long time to recover from chemotherapy. Some cancers are treated with localized radiation. Radiation causes damage to DNA, which can cause cell death. And again, it's more damaging to cells that are actively dividing. There is a very small risk that will cause a new cancer. It's there, but the technology for treating or targeting that radiation is really, really good. And it really does improve long-term survivability. Now notice both chemo and radiation treat cells that are rapidly dividing. We mentioned these in a previous lecture. Things like skin cells, cells lining the digestive tract, and cells that grow hair. And this is what causes some of those side effects that you see. Baldness, those cells are fast dividing, medicine might kill them. Digestive problems, the cells in your digestive tract are rapidly dividing. Losing some of those can cause problems. Now, the next group of treatments are more modern treatments, more advanced treatments. These tend to be called targeted therapies. And there's a lot of diversity in these. The cell is targeted because of unique characteristics for that cancer based on what genes are mutated in that cancer. So, for example, certain breast and stomach cancers produce an excess of a protein called HER2. This is a protein that's on the surface of the cells. It stimulates cell division, and there's a medication that will bind to HER2 and turn it off. It also, because it is bound to HER2, signals the immune system, hey, over here, this is a cancer cell, and the immune system can come in and kill that cell. Now, it's also going to cause problems with normal cells that have HER2, but the cancer cells have so much more of this protein that they're the ones that are largely being killed off. In addition to this kind of targeted therapy, there's immunotherapy, training the immune system to recognize and destroy cancer cells. So the treatment for HER2 protein expressing cancers stimulates the immune response. There are other ways that the immune system can be stimulated to go after cancer cells. You can create antibodies in the lab that mark the cell for destruction, similar to what the treatment for the HER2 overexpression does. Antibodies are proteins that will target a specific location on a specific protein that is on the surface of the cell. Some cancers are hormone responsive. Prostate cancer, breast cancer, these will respond to the sex hormones, estrogen, testosterone, that sort of thing. Hormone therapies will block the normal functions of the sex hormones. Humans can tolerate these pretty well. There are other hormones in the body that we really can't tolerate messing with the levels of. These other hormones are involved in regulating a lot of different processes in the body. All of these medications, in fact, all medications have side effects. Everything has side effects in some individuals. And the side effects vary by both the treatment and the individual. Chemotherapy and radiation have the longest lasting side effects. They frequently include nausea, hair loss, changes in the skin, fatigue, anemia, clotting problems, bruising easily, something called chemo brain, which people get after chemotherapy, during and after chemotherapy, that interferes with their concentration and can screw up their mood. And these can all last a year or longer after treatment ends. Target and immunotherapies tend to have milder and fewer side effects. And hormone treatments can cause menopause-like symptoms in women and feminization in men. So again, how severe that is can vary dramatically from patient to patient. So that's kind of the wrap up of treatments for cancer.